Hey guys, and welcome to another Whitney's Wonders. So today I've got another health update for you. Like I've mentioned in previous videos, there's going to be other videos in between, so my week 4 might be week 6 down the line, but I figured I'd put them out in sequence, right? So today is talking about prednisone week 4. So basically, I've had pretty much all the same side effects. They haven't went away. They haven't got worse. They're all literally the same. Sometimes like last night, I couldn't get to sleep till like 5:30 in the morning, so I just read a book to help me sleep. Um, Energy levels still up there, so that's good. And I'm decreasing the prednisone, so I'm happy that the energy levels are actually staying the same, or if not, maybe just a little lower. Hopefully that stays for the whole round of prednisone. So I've started, what I had to do this past week was do 6 pills a day of 5 milligrams instead of 7. So I decreased 1 pill. So for the next upcoming weeks, I'm going to continue to decrease 1 pill every week. And which is that it goes by milligrams as per the prescription, but for me it's pills so I can remember and it's easier to keep track because the prescription's a little hard to read. Kyle gets it, so thank God he's here because he works at the pharmacy, so he actually understands what I'm supposed to be doing with the pills, which is helpful for sure. So yeah, still still riding the prednisone train. Yeah, it's been good. I have no complaints about it really, other than the kind of side effects that are not even that negative to me. I can deal with them for sure if I'm feeling better. The sweating is a little sucks. Everywhere I go, I sweat, or like I have so much energy, so I think I can do so much more, and then I get sweaty. I even just sweat sometimes just sitting there. I wake up sweaty. I'm a sweaty ball of mess, but that's okay. I'll take the sweat over pain any day. If you live with chronic pain, trust me, you would take the sweating. So what I wanted to do today was kind of do like an origin story of how I actually started my trip with Crohn's. So some of this is kind of gross information. So if you don't like gross information, I'd suggest that not to continue watching. And this is kind of an area where I've told some people before, and I'm getting more comfortable telling people these things. But when you're a female and in your mid to late 20s and you're going through problems that involve your bum, it's not very fun. So I'm going to talk about, and this day is etched in my mind. It will be etched in my mind for the rest of my life. It was so traumatic for me, but also I try to like squeeze in some humor with the trauma so that it makes an interesting story for sure. So we'll go back to June 27th, 2013. I call that the day of the Crohn's. Now, I didn't know I had Crohn's at this time, but this is the day that everything started, my journey to getting diagnosed with Crohn's disease. So, it was June 27th, 2013. I was going to an annual general meeting at work, actually. That was the day it was supposed to be. I had previously called in the 2 days before that to work because I was having pain in like my lower back, but also like in near my butthole. So I was thinking to myself, like, what is going on? I don't want to talk to anybody about this. Like, I'm a 27-year-old woman at this time. I'm not talking about bum problems. I'm not going to the hospital. It will go away. So unfortunately, folks, when it comes to what they call abscesses, mine have never just gone away. So this is what started the whole trip down the road. So I'm living at my dad's house at the time. And, I was doing heating pads on it. I was just thinking it's getting worse and worse. I was taking muscle relaxants. I thought maybe it was a muscle problem. Whatever, I was taking Tylenols. Nothing harder than Tylenols or like Robaxacet, but it was not going away. So finally, I went to work. I don't know if it was a Thursday. It was one of those days. I think it was a Thursday. And at this point, I was working at St. Leonard's Brant Employment Center. So there was a couple people that I knew there, and I will give a shout out to Amanda. She's who I call my lifesaver. If she watches this video, she'll know exactly what I'm talking about. That's what I've deemed her. She basically, I went to work that day, and also that was the last day that I had a cigarette, because I remember I hadn't eaten in like a day and a half because everything I was eating was coming up, or I just didn't feel like, you have an infection, so you don't feel like eating. I didn't know it was an infection at the time. So I didn't eat that morning. I went to Shoppers. I went up to the till and I told the lady what was going on, and she gave me some creams. I bought a bunch of creams that day. I bought a ginger ale, and I went into work. So um, I was so dehydrated. I remember chugging my ginger ale that morning that I was so thirsty. I went out for it with a group of people and we were having a smoke, and I was just like, oh, I can't do this. I walked into the building, threw up all my ginger ale, went to my office, and Amanda came in and she said, she must have talked to a supervisor at the time or something. They said, you look gray. We're taking you to the Willett Hospital. And I said, oh, fine. Okay, fine. I'll go. So I went to the Willett Hospital, waited around there, had the lady check me out, and she says, have you ever heard of a perianal abscess? And I go, obviously not. I've never heard of this term. I didn't, like, now that I know, I wish I'd never had to hear that term again, but it's not going away. So they say, you got to go to the BGH. You have to get this thing drained. And I'm thinking in my head, like, oh my God, drained? Like, what the So I call my dad at the time, and I said, Dad, I need a ride to the Brantford General Hospital. Can you come get me? So he drives out to the Will. I think he might have been at work that day. I don't think he had retired yet. I can't remember the timelines with that, but he might have been either a year from retiring. I can't remember. So he came pick me up, and he took me to the BGH, and he sat there. I think I was there in total maybe like 4 or 5 hours. But he sat for a bit, and then Mom came, and he went to pick up my stepmom. So Mom came in, and I get back to the back room in the ER, and I'm laying in a bed, and it is so painful. Like, when I say the pain of this thing, I'm trying to think of how to describe it. How I've described it to people in the past is if you took a pickle, put a bunch of glass shards in it, and basically stuck it up your bum. I mean, there's no other good way to describe what an abscess feels like. It affects every movement that you do as well. So any movement, if I just laid still on my side, it doesn't hurt as much. As soon as I move a little bit, it's like it reminds you it's there. So the surgeon comes in, and I'm laying on my side and explaining my symptoms. Mom's there, blah blah blah, and all of a sudden you get the old beep, finger right up the bum. And I feel like I screamed bloody murder. I don't know if I did scream bloody murder, but it was loud. I went, ah! It hurt so bad. So I guess like they have to do that exam to feel around to see if there is infection there, if it's an abscess, and he confirmed that it was an abscess. So he says to the nurse, should we give her some morphine? Yep, shoots it right in the arm. It's just, that was painful too. That burn's going in, actually, morphine in your arm. So he freezes up that area. Thank God I got the morphine, because I couldn't have taken that much longer. So the morphine's setting in. I'm feeling less pain for like the first time in 4 days, and I'm sitting there going, oh. So I can't feel anything because that area is numb. And that's when he proceeds to do the drainage. And folks, this is the gross part I was talking about. There was a lot of stuff that came out. So I had so what an abscess essentially is it's a little ball of pus inside your body. So if you've heard the term boil, like on the outside, the abscess is what happens on the inside. So unfortunately, I have fistulizing Crohn's disease, which I get fistulas in my body, abscesses that turn into fistulas. So that was drained. Morphine, immediate relief, felt great. And then what after they have to do with that is he packs the wound. So there's these long pieces of gauze. They're very small, and say this is where it's going. They just pack it deep in, right? So to keep it from closing back up, because what an abscess does is, if this is the other side, this is your skin here. You don't want this closing up before this heals, or it's just continue to abscessing, and you're going to be dealing with problems, or like I had and didn't know at the time, turned into a fistula. So he packs it up. I'm with Mom. I remember her laughing at. Mom is great for laughing as well. She knows the time to laugh, even if I'm not in the mood, but it kind of makes me laugh as well. And I was on the morphine, so I was better after. She said that the smell was ridiculous. But yeah, so we pack it up. He sends me home. He says nurse home healthcare will be coming to visit every day. So at that point, I think I was off work for like 2 or 3 months after that. Now I'm off only for a week because I know what to expect with them. But each and every day, a nurse from Vaughan came to my house and repacked the wound. Now, because of where the area is and because I have Crohn's disease and how much times I go to the bathroom, the packing never really stayed in anyway, and I was not getting mom to repack because maybe I'll tell some of those stories along the way of mom trying to pack that abscess wound. Yeah, not fun. But the nurses, they try to, so they can move on to other people, get people in your family to learn how to do that stuff to help them out, right? So they don't have to come every day. But that was not happening at our house, so they had to come every day. So in total, I probably had like 20 to 30 people look at my butt. It's great. If you asked to see it now, I'd probably allow it. Who knows? But so they'd come every day, take the old packing out, and then pack a new one every day in there, which I'd take a Tylenol 3, I believe, every day before they'd come because the packing was just as bad. Ugh. But whenever I have these abscesses, now I just go through my surgeon, Dr. Kelly at the Juravinsky in Hamilton. Like I said, he puts me out, gets me in surgery, drains it. I'm good to go. But every time I have one, the packing is just horrendous after. I wish in 2021 they could come up with a better way of doing that isn't as painful, and it's just irritating too because the spot I get it is so hard to keep clean. It's so hard to keep it like with the packing in. It's really, and then you start like getting anxiety because then you're like, oh, is it going to reabscess? Is it waiting too long? Is it doing this? And then my poor husband, Kyle, like, he's had to do so much stuff to help me out in terms of this. I appreciate him so much because there's not a lot of men out there that would do this kind of stuff for their women. And I know that I truly, completely love him because of what I allow him to do. Because, folks, it can really take down your self-esteem, these things, but I just keep trucking because what else can you do? And I like the fact that with this stuff, too, like, you can't tell I have problems in that area because you can't see it and you don't know unless I tell you. So unless I'm telling you like I am in this video, you would have no idea that I have these problems. So what I have in there right now, because I tend to get them in that area, I haven't had an abscess, like I said, in a couple years now, so thank everything for that. But I have what's called a ceton in. I had 2 originally, and one fell out on his own. So the surgeon said that would mean possibly that other fistula healed on its own, and it pushed the ceton out of my body. So what a ceton is if you basically think of like a twist tie. So say this is the entrance right here, right? The ceton, if the abscess was over here and this is the fistula tunnel that came from that, the ceton goes through the loop, back out, and is tied so that it keeps that tract open so that it doesn't reabscess. So I've lived with this one probably for about, I think I've had it in before I met Kyle. So I think about 8 years now I've had this ceton in. So you can have them in, I guess, for life because I'd rather have that than it reabscess until they go. They have other things to try too, but because of where all the muscle is in this section of mine, it goes by that. The surgeons look at that. They don't want to make people incontinent, meaning that you're just going to poop yourself. So if there's muscle involved, they usually do a ceton, but there's other things they can do surgically. I don't know all of them because I've only done this one. But I know that they're trying to come out with new things to make it easier to heal up these fistulas because they are really irritating. And as of right now, the biologic medication that is there that I've talked about for Crohn's is really the only thing that can help the fistulas as of right now. The surgeries can, but there's a lot of failure rates. It's a huge failure rate for a lot of things actually. So a lot of people take their chances with it, right? So yeah, that was basically the day that I quit smoking and then also started my Crohn's journey because after that, then the surgeon who did it, which I won't even get into him because I did not like him at all. But, and if I say his name, there's probably people out there who know who he is and know that he probably shouldn't be practicing medicine as a surgeon. But whatever. So after that, we started, my Aunt Sandy came with me, got me referrals to great doctors. All the doctors I have right now is because of my Aunt Sandy. Coming with me to those appointments and pushing for what I needed. So I loved it. I watched her. Now I go by her example because in the medical field, you have to be your best advocate because they will just push you away. They will say, oh, you don't need that. Say you need it because you know your body better than everybody, right? So when you know something's not right, you know something's not right. You got to get it checked, unfortunately. But yeah, so after that, I started all the testing for Crohn's. I did a colonoscopy and there she was. So it's been a battle since then. That was the scariest thing I've ever been through. Now looking back, I'm like, it was scary. It was intimidating. but now I'm just so used to these things that it's like second nature to me. So it's crazy. So I wanted to start to do today's video basically just telling you what happened, basically some of that embarrassing stuff I've been through in terms of that. I've got some other stories through the years that we can go through, but that is basically chapter 1, the day of the Crohn's. So that's what I call it. So I actually even thought of like writing a book about it all, like just basically like a journey so I can remember things. I haven't done that. I should do it before it gets too much and I can't remember because there's so much that has happened through the years, good and bad. And yeah, so basically Prednisone week 4 is going same as it has, nothing else different or whatever. And then I wanted to give you a little story of my first attack, really is what I call it. I think I had it way before actually, because I've had my gallbladder out, I've had problems, and that was probably related to Crohn's and I just didn't know it at the time because it is in my family, right? So I might have had it for a while, just didn't know. So that's it for today, guys. Quick update on the Crohn's health there, and hope you're enjoying these videos. I love all the feedback I'm getting from you guys. It's really nice. Thank you so much. I enjoy it. It's wonderful. Keep it up, and more videos on the way for you. So take her easy. Peace.